Welcome, and thank you all, presenters and audience alike, for participating in this innovative approach during COVID lockdown. I hope most sincerely that we may all meet again soon. This webinar is produced to demonstrate that the management of the young sports horse is the most important influencer of sports horse performance and longevity. I believe that optimal performance in the older horse is only achieved by communication and cooperation between advisory professionals from day one. Protocols, through both experience and research, have been developed to achieve this, demonstrated in the webinar, which is a collaboration between myself, Emma Short, who is a highly experienced equine qualified Bailey's nutritionist, Dean Dibsdall, Master Farrier and Associate of the Royal Company of Farriers, and Helen Dart, a Society of Master Saddlers Master Saddler and Society of Master Saddlers Master Saddle Fitter. This presentation was originally produced for PKW Events, entitled Equine Arthritis, Diagnosis and New Technology, which was to have been held in a two-day seminar between the 20th and 21st of March this year. This did not take place due to COVID-19. This webinar is now produced on behalf of and sponsored by British Breeding, Bailey's Horse Feeds, the Society of Master Saddlers and PKW Events. Besides the presenters, Lucy Hyde-Thompson is also in attendance for technical support. Lucy's skills are greatly appreciated and she may interject to advise the presenters and relay questions. The webinar will be recorded onto the sponsors and presenters' social platforms. Personal recording is disabled. There will be a Q&A presenters panel discussion at the end of the session. The Q&A icon, as you see here, is on your meeting control bar. You may ask a question by typing in the Q&A box. Please include the presenter to whom you are addressing the question. This is the Q&A feedback form, and you will see that there is an icon which you can click when you wish to record a question. You may ask a question by typing in the Q&A box. Please include the presenter to whom you are addressing the question. The raised hand facility has been disabled. I now have some very exciting, indeed breaking news statement from British Breeding for you all. This is with regard to the Futurity Evaluations 2020. And the statement is as follows. In line with social distancing and government guidelines, the 2020 Futurity will be carried out online using videos and online communication technologies. This will enable us to maintain the consistency and high standard of evaluations which rely on the involvement of world-leading experts without putting our team or any of our breeders at risk. Right, we will now start the presentation. first question that we should ask ourselves, ladies and gentlemen, is why should we ride horses? And the answer to that is there is a very close human-horse bond for both the horses and our own physical and mental well-being. Social license to operate. An increasing proportion of the media in the Western world truly believe that the horse should not be ridden on ethical grounds, both physical and mental. This challenge is not new, but its scope and rate of change have increased massively. We must therefore all ensure good equine welfare, and we can do this by working together to promote improved longevity of equine performance. Attention to detail is key, i.e. micromanagement from day one. The young horse. Whatever the discipline, we all would like all our young horses, and consequently our older horses, to be forward, balanced and level. And these features are all interlinked. I cannot stress how important attention to detail is from day one, between, of course, the producer. The most important, in my view, attendee of the horse, other than the producer, the farrier, the vet, and the nutritionist. An example is problems that may occur in the young foal, which may not easily be recognised. We now know from work done in 2015 that if a foal's foot, for instance, a front foot is higher on the outside, known as outside high, for instance, the blue upward arrow, the opposite inside wing of the pedal bone is likely to suffer a hairline fracture, and vice versa. This is usually non-painful. The owner or carer are almost always unaware. It will in time lead to a club foot and imbalance and lameness later on in life. Hence, the very, very serious importance of keeping foal's feet correctly balanced from the very beginning. Now, the gestation period is extremely important. I'm going to pass you over to my colleague, Farrier Dean Dibsdall, to discuss this. Dean.
Thank you very much, Jane. I'd just like to introduce myself. My name's Dean Dibsdall. I'm an associate of the Worshipful Company of Farriers, a master farrier, and also an approved training farrier. And I've been invited to help with this talk today to just give you a working farrier's view on what we do every day, and to trying to give you a good idea on foot balance, really. And it all starts with the gestation period, and all our focus is obviously on the mare. We need to be aware that the mare is carrying an extra load, an extra weight, and that has consequences to the hooves. We need to be aware that feet will potentially start to splay or crack. They can potentially get low weak heels. Frogs can prolapse, and we just need to be aware of all these. So when this happens, you get your farrier in to try and keep everything in balance and together. And studies have shown now, if the mare has or had laminitis, it's been proven now that it can actually go into the foal and affect the foal in its early stages of its life. So we need to be aware of that.
Thank you, Dean. Now, we're now going to meet Emma Short from Bailey's Horsefeed, who will talk about good foundations. Emma.
Thank you, Jane. From a nutritional perspective, we want to be starting with good foundations. And the growth of the fetus begins from conception. Therefore, we need to consider feeding really in the same light, and not just in the last trimester, which traditionally has been recommended in the past. Over or underfeeding during the course of the reproductive cycle can impact on the foal's development, leading to metabolic bone disorders in later foals or small, weak, underdeveloped foals at birth.
Thank you, Emma. Parturition and the postnatal period is of extreme importance. If a foal has had a difficult birth, for one reason or another, the passage through the birth canal may lead to asymmetry. I know that a number of elite and other studs employ the services of a physiotherapist within the first 3 days of life to ensure that no damage has been done by passing through the birth canal. And then immediately after that is a very important point. We all lead our horses from the left-hand side. But of course, it has an effect on the laterality of the horse, which means that they tend always to bend their head and neck to the left, their hindquarters move to the right, their left hind leg has more loading, and as a result of which, from day one, through no fault of their own, they become asymmetrical. The very, very well-known racehorse trainer, late racehorse trainer Vincent O'Brien, he realised this and he led all his offspring from, for instance, one side leading out in the morning and the other side bringing them back. And I think this is absolutely essential to bear this in mind in order to encourage our horses to be bilaterally symmetrical and not to have laterality problems. Now we need to speak with Emma now with regard to the mare and lactation. Emma.
Thank you. So it's estimated that the foal at birth is around 10% of its mature weight. And this increases by about 30% in the first 3 months of life. So it's growing incredibly quickly. And during this time, the foal relies upon a majority of its nutrition to come from the mare's milk, as we'd expect. You can see from this slide, what we're trying to illustrate here is the volume of milk that the mare produces from birth to around 4 months of age. And you can see that the mare's milk yield peaks at around 5 weeks into lactation. It then starts to peter off sort of around 3 to 4 months in, which is indicating that the mare is preparing the foal for weaning. The issue that we have at this sort of 5-week mark, although the mare's milk will be supporting the foal's requirements for both energy and protein typically, as the yield increases, so as she's producing more and more milk, the quality with respect to the mineral density of the milk starts to decline. And you can see that from the next slide. This slide is essentially showing you 3 different types of minerals. Again, you're looking from birth to 4 months of age. And you can see here that we're looking at the zinc, the iron and the copper levels within the mare's milk. And you can see again, looking at that 5-week mark, that the mineral levels start to decline at this stage. So what we're faced with is we have a lot of milk being produced by the mare, so we have a lot of yield, and therefore a lot of energy being produced, and the mineral density of the milk starts to decline, and we have a disparity here between energy and mineral content, which can increase the risk of developmental problems from occurring. Thank you, Jane. So foals born to mares that have not been supplemented correctly during pregnancy are at much higher risk. And we see this frequently where the mare's nutrition has been suboptimal, resulting in developmental issues at birth as well as moving forwards. And it's due to the foal not being able to accumulate sufficient mineral liver stores during gestation. So this, combined with the mare's milk being low in essential minerals and also high in energy, really increases the risk of developmental abnormalities from occurring. So really highlights the importance to feed or supplement the mare during pregnancy.
Thank you very much, Emma. Now we'll turn to 6 weeks to weaning. When to wean. This is highly variable and very much depends on your circumstances. Nevertheless, a very, very important factor is from this stage for the rest of the horse's life, there really must be mutual respect between the handler and the horse. This means that the youngster should be amicable to being handled. And if it requires weaning for this reason or for any other reason with regard to growth, it's essential to wean at that appropriate time. Foals with above average growth rates may need their diet monitoring. Perhaps they should be weaned early. Feed type and intake are influenced by the time of year and the weather conditions. In the warmer weather, we have a higher rainfall with an increase in grass, and consequently we may develop, or the foal may occur developmental problems. So now Dean is going to discuss with us from the farrier's point of view, 6 weeks to weaning.
Thank you very much, Jane. Okay, so from a farrier's point of view, when it comes to foals at this stage in their life, it's really important to understand the rapid weight that these foals are putting on, and the effect it has on the hoof capsule. Things can go wrong pretty quick because the growth plates are still moving and things can move in any direction. We need to be aware of the ground surface. We need to especially be aware of odd feet. We need to keep track and try and get these feet as even and symmetrical as we possibly can. And I think it's really important, if you can liaise with your nutritionist, it really helps working as a team to get the best you can for the foal. So the practical side of things, when it comes to trimming feet, first thing is we need to try and keep the hooves and limbs as balanced as possible using the correct protocols, such as trimming on a weekly, 2 weekly, 3 weekly, 4, depending on the severity of the deviation. We've had foals where we need to visit every 4 weeks, and sometimes we have foals where I have to literally go to 1 foot every week just to trim one side off to try and keep that hoof capsule as straight as we possibly can. And if you can't get what you want from trimming alone, we do have things such as hoof cuffs, acrylics, or anything that we can try and manipulate the limb to be straight and try and prevent an angular limb deformity.
Thank you, Dean. Now, the next thing we have to consider is steady growth. So I'm going to pass over to Emma here, who will discuss this from her point of view.
Thanks, Jane. To achieve balance as much as possible, we need to ensure that growth is as steady as possible. And the youngster can only ever mature to its genetic potential. However, we can influence the rate it gets there. Large fluctuations in growth rate should be avoided, ideally, as it will inevitably be followed by a period of compensatory growth, or catch-up, if you like, which can affect the growing skeleton and the associated tissues. And this ultimately influences the foal's soundness and ability to perform as an adult. Thanks, Jane. Higher energy diets can stimulate how quickly the foal grows, and these calories typically will come from, at this stage, your grass, your milk from the mare, or any feed that they may be receiving. And an increase in growth rate needs to be supported by sufficient nutrients. So looking at your amino acid profile, your vitamins and your minerals, to provide the building blocks that they require to develop tissue correctly. Rapid growth rates can contribute to an increased risk of growth problems, whereby there's a failure of cartilage to develop into mature, healthy bone, which increases the risk of poor bone strength, as well as quality and also soundness in the adult horse, as well as also asymmetry. By the time the foal gets to 3 to 4 months of age, his diet will need to be adjusted to accommodate his changing needs. And this slide is illustrating how the digestive tract alters and changes as he matures. So you can see here that we have different digestive enzymes. And again, you've got the age along the bottom, so from birth to around 6 months of age. You can see lactase, which is the enzyme responsible for breaking down lactose, a sugar within milk, is relatively high in the first few months of life, but significantly declines, particularly at around sort of the 6 month mark there, obviously in preparation for sort of weaning. You can see on the other side, you have amylase and protease enzymes, which are increasing during this period. So they start off low at birth and they start to increase. And you get this crossover at around sort of 3 to 4 months of age, indicating that this is a good time for us to start looking at introducing some different feedstuffs other than milk into our foal's diets in preparation for weaning. Thanks, Jane. So we're typically looking at introducing or transitioning our foals between sort of 3 to 6 months of age from a milk-based diet onto one that's designed to complement forage, so such as the stud feed. So whether that be a stud balancer, a stud cube, or a stud mix, really to complement the forage that you have. And it's very much key that you are aware of what your forage is providing from a nutrient or energy perspective, Your forage can very much vary in quality and can fluctuate, particularly when you're looking at your fresh grass pastures. So it's a really good idea to try and sort of keep on top of that and evaluate what type of forage you're offering to your young stock, because actually it can make quite a big difference with how much you feed and also what type of stud ration is going to be most suitable. Now, this changeover, so this transition period, really helps to compensate for the natural decline in both the mare's milk quality, which starts to decline, as we saw earlier, at around 3 to 4 months of age, but also obviously the quality with respect to mineral levels. And actually we see that it really, when we're in yards and we're working with customers, we really see that this helps to reduce stress at weaning. It also helps to lessen setbacks, as well as reducing the risk of compensatory growth spurts also. So growth problems can occur not only from nutrition, but from trauma, conformation and genetics. But from a nutritional perspective, it's usually from either over or under feeding a stud ration, or possibly not using a stud ration at all. You might be using something like a high fibre cube, for example, as your main bucket feed. But usually when we're working with customers, it's very easy to sort of make adjustments so that we can iron out these problems. It could also be that maybe you're feeding the correct quantities of your stud rations for the correct sort of age and for your breed. But the balance could still possibly be imbalanced, and that's typically due to forage imbalances. If you have a grass or hay or haylage, for example, that maybe is particularly low in a particular mineral, or your protein levels will fluctuate with fresh pastures, for example, we still need to be sort of looking at balancing the ration. We also need to consider how heavy the foal, the youngster is. So it's seen that anything that's top heavy, therefore overweight, is putting excessive weight on young developing limbs, and therefore they will have a much higher incidence of growth related problems. So looking for something that's got a much lower energy or calorie content, so we can help to sort of monitor growth rate, but still support the tissue development with respect to vitamins and minerals. So things like your stud balances in this instance are ideal. Thank you, Jane. So we see where there are excessive levels of energy or calories being provided, this basically creates a disparity between the rate of weight gain that your foal will have, the skeletal growth, as well as the micronutrient supply during these periods of growth. And your micronutrients are key. They're required to support correct tissue development. So if you have a large amount of energy coming through from the diet, whether that be from milk, your bucket feed or grass, or a combination of the three, with insufficient micronutrients there to support tissue development, we get an imbalance, and it generally leads to issues such as your flexural limb deformities at this time. Thank you.
Thank you, Emma. Now we've got to the yearling stage, and this is the maintenance stage. Yearlings have attained 65% of their mature weight by the time they're 12 months old. So there is still a window of opportunity to ensure correct development, and this is both mentally and physically. And I must reiterate the issue of mutual respect between the horse and the handler. At this stage, we must avoid excessive body condition score or excessive loading on the limbs, and equally, we must maintain correct foot balance. So I'm going to ask Emma now to talk about monitoring growth rates. Emma, please.
Thank you, Jane. So we can keep weight and growth rate under control by monitoring it as much as possible. And this helps to basically identify rapidly or slow growing foals. And it enables us to have an early warning system, if you like, whereby we can adjust the diet before problems are evident. So if we need to cut back, for example, on the amount of concentrate, or change the type of concentrate or forage that our animals are getting, we can then adjust the diet quite easily. And it allows a much more accurate calculation of how much we actually need to feed them. Thanks, Jane. So we basically want to be looking at assessing both weight as well as condition. Weight is a great way of us to be able to calculate how many nutrients or how much energy our animals need. And it can be very easily done by using something like a weigh tape, which most of us have access to, It's an easy tool to use. However, they are not 100% accurate, but they do give us an indication of any changes that may be occurring. Now, whether you do this weekly or 2 weekly, I'd probably suggest weekly, certainly with your young stock, because they're growing very quickly and we can then make adjustments far more easily. If you have access to a weighbridge, then fantastic. Obviously there are nutritionists, feed companies, etc., that can maybe bring out things like weighbridges to you on occasion, and they are far more accurate, but they don't take into account the body type of the horse, how much muscle and how much fat they have. And this is where things like your body condition scoring really come into play. So we would recommend that you do the two together. So you're weighing your animals, so you see how heavy and see how they're changing, but also body condition scoring them, which is much more of a visual and hands-on method, so that you can actually evaluate body fat and also muscle tone. Thank you.
We've now got to the 2-year-old stage, and there is a huge amount of misunderstanding about when we should start ridden work. Research from the States and indeed from the UK has shown that the 2-year-old racehorse in training, if that horse is, or young 2-year-old is correctly ridden and managed, if that horse then goes on to be a hurdler as a 4 or 5 or 6-year-old, and then a national hunt horse, i.e. a steeplechaser, that horse which jumps, if it has been brought into work as a 2-year-old, will have a more sustainable career, both in terms of freedom from lameness and longevity. So in other words, correct training of the young horse is a definite plus, as long as it is done properly. Conversely, the 2 to 4-year-old sports horse in training, we still have problems in this respect. And this was brought to the current panel's attention, the British Breeding Equine Bridge last September, when we were joined as an observer by Dr. Rachel Murray, world-class veterinary surgeon. By that I mean veterinary surgeon to the Olympic disciplines. And we were dismayed at the standard of the production of the 5-year-olds. Between us, we examined in hand and under saddle 18 horses. 88% of these horses, in our opinion, could have been produced better, and there were welfare issues which were apparent. Regretfully, these were mostly people trying to encourage their horses to work before they were musculo-skeletally mature. A number of these horses were worked in an asymmetric fashion which went unnoticed. And most importantly, quite a large number of them, the saddles did not fit, partly because the producers were laissez-faire with regard to which saddle should be put on a young horse, which was a great shame, and of course would have a lasting effect on the horse. And secondly, because a number of people did not understand that at this stage, because of their production, these horses were asymmetrical and therefore needed a saddle which consequently fitted them. So now I'm going to go back to Emma to talk about feeding of the 2-year-old, please, Emma.
Thank you. So by the time we get to 2 years of age, our horses have matured by about 85 to sort of 89% of their weight is typically achieved at this time. And as your growth rate slows down, then nutrients as well as their energy requirements are also being reduced. Thanks, Jane. So we are basically looking at feeding for maintenance in terms of body condition and energy intake. And it's really crucial that we don't get our young stock overweight. We see it a lot at the pituitaries where our 2, 3 and 5-year-olds, etc., are becoming bigger and bigger. And therefore we need to really ensure that the calorie content is kept under control. And the majority of the time, balancers alongside mainly forage-based diets are generally adequate in order to meet nutrient requirements, as well as energy levels and calorie requirements as well. However, do be aware of what your future plans are going to be. So if you're planning to obviously back your young stock earlier and therefore start to do a little work, etc., the more work they start to do, you will need to possibly look at changing your diet in order to support both calorie and energy requirements as they do more, because they are still growing. So although growth rate has slowed down, they are still obviously developing still at this time. Thank you. By the time we get to 3 years of age, they will have reached nearly 95% of their mature weight. And again, the emphasis really is to maintain a balanced diet to ensure that amino acid, vitamin and minerals are being met, but we're not over supplying energy or calories at this stage. Again, as workload is introduced and increased possibly at this stage, you may need to increase both energy or calories accordingly. But if your horses are maintaining a very good weight of a forage-based diet, then please look at a low-calorie balancer option. And the role of nutrition should not be undervalued in the role of the musculoskeletal development. Thank you.
Thank you, Emma. Now, the one thing that is just so important by the time we got to this stage is that we hope we are as symmetric as we possibly can be with our youngster. Asymmetric development inevitably leads to reduced laterality, unilateral loading, lameness, and uneven back muscle development. Weak or poor conformation will cause feet imbalance, requiring constant correction. Foot balance. We must always look at the left versus the right, both in front and behind. And these are adjuncts to the correct development of the musculoskeletal system. Foot balance is of the ultimate importance, and I'm now going to pass over to Dean to describe this. Dean.
Thank you, Jane. So yeah, I'm just going to talk to you a little bit about foot balance from a farrier's point of view. There's a couple of bullet points here that I picked out from books that I like to share. It's amazing really that actually nearly 95% of all horses have some sort of foot imbalance, which could lead or predispose them to an injury in the future. We need to know what is good and what is bad. As we know, no foot, no horse. So hopefully I'm going to show you a couple of slides a little bit later of some good hoof balance and some bad, and hopefully we can work out, and so you get a good eye to find out what is good and what's bad. Good foot balance is achieving a foot which is of good shape and good strength to support the weight of the horse whilst providing a good base for optimum movement. And poor foot balance eventually leads to a whole host of musculoskeletal disorders, so we need to be aware of this. Flat, level and balance. Okay, so some really simple diagrams here. As you can see, the photograph on the right with the blue lines and the drawing on the right with the arrow. This is one view that us as farriers use to try and find balance to a hoof capsule. So the vertical line represents a cannon bone and the horizontal line represents the solar surface of the foot. And in the middle, you can see that you can have a flat solar surface of the foot, but it's not actually in balance with the limb. And as farriers, it's really important not to only assess the horse statically, but we need to definitely walk the horse up dynamically to find out what's going on. Because not only you can see at this view or statically you can see a horse and it might look good, but then dynamically you can see a totally different picture. So you definitely need to do both. Okay, this is a good fact that actually a hoof wall will actually revert back to being imbalanced unless it's not trimmed to balance. So basically, I've got a good analogy here where if you imagine a cluster of drinking straws, nice straight drinking straws, they represent the makeup of the hoof capsule quite well. Lots of tubules compacted together. And if you got some nice straight ones and you put weight on top, you'll find that the tubules will be able to resist that weight. But if you have a bunch of drinking straws that have got a kink in, you know, the ones that bend, and you try and put weight on those, you'll find that as soon as you put weight on the tubules, they will bend in a certain direction. So my point is, if the tubules aren't as straight as you possibly can, as you put weight through the hoof capsule, it will revert back to being imbalanced. Okay, so the hoof capsule. So the hoof wall is heterogeneous. So it differs in structure from both the inner and outer hoof wall and from toe to heel. It may also be called as anisotropic, meaning its physical properties are not the same in every direction. It's thicker at the toe and thinner as it goes towards the heels. From the quarters back is where most of the movement happens. A lot of people ask, why is this? Why doesn't it move the same in all directions? Because the pedal bone, it has laminar attachments, and that's how the hoof wall attaches around the toe. But from the quarters back, the attachment is different, and that is designed to help aid with the anti-concussive mechanism and allow the hoof capsule to disperse energy through the foot and through the hoof capsule itself. Some ideal angles in front are around 50 to 55 degrees in front and 55 to 60 behind, and this is in the ideal mature horse with good conformation. Okay, a couple of photographs here of customers of my own. This one came to me from a show jumping yard, and the previous instructor believed that the higher you leave the heels, the higher the horse would jump. Little did he know about the hoof capsule and what can happen when things aren't right. So the photo on the left shows that the heels are super high, and they are stopping the foot from allowing the foot to contract and expand and absorb energy from the ground up and from the limb down. And what's happened here is the tubules are so straight, the forces have met in the middle, and they've caused a crack on this lateral side here, and this red ring replicates the collateral cartilage. And what's happened here is as the horse has been jumping, it's forced a crack and actually started to push the collateral cartilage out the coronary band. And the photo on the right, you can see I tried to fix this. I put the angles correct, I applied a bar shoe, and I've actually floated that outside heel to reduce any movement in that crack. And once that grew down, I repaired it with a crack repair, and that horse is working fine now. Odd feet, heel depth, these are a nightmare. We need to be aware of these. So I'm going to give you two photographs here. A really easy one. The one on the left, you can see one foot's got really high heels and the other foot's got really low. So this is what you need to spot. The one on the right, again, is one of my customers. We took some shot. This is a photograph palmally of the front feet, and the high heels is not so obvious, but I'm going to try and help you out. So the photo, the left limb, you can see there's a black triangle in the middle. That is the central sulcus of the frog. And if you take note of the hairline and the bulbs of the heels, they're higher on this one. If we move to the right foot, you notice the hairline and that triangle is not so apparent, and the heels a lot lower to the ground. It's not so obvious, but this is what you need to be aware of, because an indifference like this can make a big problem higher up the limb of the horse. Odd feet are a disaster waiting to happen. Radiographs of uneven feet in lame horses indicate upright foot with deeper heels showed an atrophied deep flexor tendons running over the subsequently roughened border of the navicular bone. We need to be aware of this because it can cause issues, and not necessarily straight away, but as the horse goes through its life, there will be problems that we need to sort out.
Thank you, Dean. That was an excellent description. Now, with regard to heel depth, and here, as Dean has mentioned, we're looking at the depth between the hairline to the floor on a hard level surface. Essentially, front feet with a low heel. So if we look at the front feet and we have one heel lower than the other, this will give the mechanical impression of lameness in the opposite forelimb. With regard to the hind feet, a low heel will give the mechanical impression of lameness in the same limb and the opposite front limb. Now, Dean's going to refer now to inside-outside or mediolateral feet imbalance. Dean.
Thank you very much, Jane. Okay, with technology today, using our phones, I think it's really good if we can just film our horses walk up, because it's really hard to see with the naked eye an imbalance sometimes. But here's a really good one. This is what we call secondary medial loading. So that the outside of that hoof is landing first, then it falls over to the inside, and that's an imbalance in the hoof capsule. You just go on to the next one, Jane. Okay, so we got some radiographs of, on the left, we have a nice symmetrical balanced foot. And what's really important when it comes to radiographs, what we're looking at is the joint surfaces. In a balanced limb, you're going to find an even joint surface. And if we move over to the radiograph on the right, we've got an imbalance here. It's pretty obvious, you can see it. But what's really important that we need to be aware of, when you get a foot imbalance, it doesn't just affect the hoof capsule, it affects each individual joint going up the limb. And if you've got an imbalance where this cursor is here, it's going to be narrow on one side and thicker and wider on the outside. So that is an uneven force going through each joint. So we just need to be aware, and that just shows how important foot balance is. Okay, one more drawing of secondary medial loading. Palmar view of the left fore, all the weight's coming down on this left side here, all the weight's coming down on this outside, and it's a two-stage effect. So it lands on the outside and loads the inside, and it actually causes almost like a whiplash effect on each joint. And along with the imbalance, you're going to get all that joint pain eventually. So it's really important to try and get a level footfall.
Thank you very much, Dean. Now I'm going to actually show you a video of a horse with right fore secondary medial loading. But before I do that, I'd like you to understand how important it is that a horse is correctly presented and correctly led up. The young lady leading this horse, she and I have been working together for 35 years. Her name is Louisa. Very many of you will know her. Louisa is the best person I know for walking up a horse for me. You will notice that she leads the horse in a completely straight line and that she is looking in the direction in which she is taking the horse. You'll also notice that her hand is directly over the horse's sternum, and throughout the walk-up she is keeping the horse's head and neck straight so that the spine is straight. So I do not have any indication that this horse is anything other than what I should be seeing. In other words, she is assisting my assessment of the horse. Now, as we walk forward, first of all, you'll notice that she keeps the horse's head in a straight line. The good foot is the left forefoot. And the left forefoot is landing nicely, the inside and outside of the foot at the same time. The unbalanced foot is the right forefoot. And it's quite plain to see here that the horse is landing with the outside of the foot first and then landing very heavily on the inside heel, hence secondary medial loading. And this horse would succumb to the problems that Dean described in the last slide. Now, the competition horse and angular and rotational limb deformities. I formed an opinion over 4 decades in equine practice and dealing with multiple types of horses. All rotational and limb deformities are a problem, particularly if they are more on one side, the left, than the right. The first picture that you see with the horse looking at us has got good conformation. The picture in the middle has got atrocious conformation. Any horse that turns out his feet in this way is literally asking to become unsound or unlevel over time, particularly if one leg turns out more than the other. And similarly, toe in is not a good sign. It is not so serious as toe out, but nevertheless, particularly if one toe is turning in or one limb is turning in more than the other, that is deleterious. And so in my mind, I have, which I'm adamant is correct, is an 8-10 rule, which is this. If a horse has an angular or rotational limb deformity, by the time that horse is 8, if you or I were to trot that horse on a hard level surface downhill, we would notice some unlevelness or disparity between the left and the right hand side. And by the time this horse is 10, he will be clinically lame and have to be managed thereafter. So it is just so important that we try to avoid these problems from an early age. And I'd like to describe to you one case where it's one foot, which has a deeper heel than the other, can have an effect on the whole body. So the front foot with the deeper heel will almost inevitably mean that the shoulder blade may be a little lower on that side, and the saddle may not fit. The higher heel may cause a suspensory ligament pain, which in turn, if the horse is lame, will cause uneven loading down the horse's back, and in which case he may then succumb to hind leg lameness. So one thing leads to the other, and we must always look at the whole horse. Now we do need to understand the difference between the forequarters and the hindquarters. The torso, the rib cage, is slung between the forelimbs with a muscular sling. Unlike ourselves and the cat, horses do not have a collarbone. We have a collarbone that goes from the shoulder joint to the sternum. And this, of course, has evolved because, particularly the cat, we climb trees, or we did climb trees. The horse never has climbed trees. The horse has a fright-flight reflex. And therefore, by the torso being slung with a muscular sling between the front legs, this acts as an anti-concussion mechanism. Conversely, the hindquarters, the hind limbs, are attached to the pelvis and the spine with a bony attachment at the hip and the sacroiliac joint. So anything that occurs in one hind limb of a horse will be magnified up the limb and have an effect on the spine going forward, right the way forward to the neck and even the upper neck. So it's very, very important to be aware of this anatomy. The hind limb is attached to the axial skeleton, that means the spine, via the pelvis, i.e. the hip joints and the sacroiliac joints. And this causes the greatest changes in the symmetry of the pelvis. And this is very frequently related to the shoeing cycle, the shoeing cycle being the time between when a horse is shod from one time to the next. The hind feet undoubtedly become more unbalanced over time than the front feet, which in turn causes asymmetry and torque on the pelvis. The hindquarters, the flatter the pelvis, the more muscle we have and the greater strength and flexibility. Horses with straight hind legs are unable, the horse's legs are unable to come underneath him so well. Horses with an acute hock angle are less able to carry weight, and horses with tarsal valgus, i.e. not hocked, are more likely to succumb to pelvic fractures. I would say the most important take-home message of this webinar is that between us we must try and avoid hind leg secondary medial loading, particularly on one side, because we will wind up with a torque on the pelvis, asymmetrical muscle development, hind leg lameness, a horse that's difficult to fit the tack, and a horse that's difficult to ride. Now, this video is a good example of left hind secondary medial loading. That's the white foot. So first of all, look at the right hind, the black foot, and you'll notice that the left and right hand, so inside and outside of the foot, land at approximately the same time. Now look at the white foot, and you'll see that the outside toe hits the floor first, and then the inside heel. Now, what you really must see here is that there is a tremendous load due to the foot imbalance here. This is curling underneath. There is a big load on the inside of the pastern, a big load on the inside of the fetlock, and a tremendous load on the inside of the hock. And these things are all very, very relevant to the development of our young sport horse. So, shoeing. Shoeing will only complement the foot if it is balanced. If the foot is well balanced, it will be a support to the foot, and of course it's discipline specific. Therefore, our biggest challenge in the young horse development is foal asymmetric feet, which lead to problems elsewhere over time, a poor saddle fit, hind limb lameness, back pain, and saddle fit. I'm sure many of you have seen this picture before, courtesy of Dr. Sue Dyson, where the horse is asymmetric behind, the saddle is slipping to the left, and the rider's torso is moving to the right, a highly unsatisfactory situation. Dr. Dyson in 2015, in her literature review, noted that 15% of horses with saddle slip were also associated with hind leg lameness, yet only 2% of the riders associated hind leg lameness with saddle slip. And equally, a rider had 39% of them associated back pain with saddle slip. And this was usually due to the decreased stride length in the canter. And this, of course, reduces the rider's ability to follow the movement of the horse, and ill-fitting saddles are associated with this problem. Therefore, it's a vicious circle. Well-fitting saddles are associated with less frequent saddle fit. Well-fitting saddles are associated with frequent saddle fit, and skilled riders may be able to decrease the thoracic lumbar asymmetry. Now we're going to talk about 3 to 5-year-olds. It is so essential that you continue with the correct foot balance, that the horse is shod correctly for the discipline, that you employ cross training. One of the biggest problems that we have inevitably is with the wonderful surfaces or not so wonderful surfaces that we have now, and for our own ease we go in our arenas time after time after time, day after day after day. The poor horse develops repetitive strain syndromes, and it is no wonder that they develop principally hind leg suspensory desmitis, problems in the sacroiliac region, etc. It is essential that young horses, 3 to 5-year-olds, go out and hack. This, the smart name these days, is called cross training. In my day, and a lot of your days, it was called let's go out riding. So ridden work must as well be compatible with the development, for instance. And Dr. Rachel Murray has shown this quite explicitly, that overworking young horses, for instance, getting them to do an extended trot when they're not musculoskeletally sufficiently developed, will lead to back problems. So there is a whole gamut of things that we need to consider. We cannot consider just one area on its own. We need to take everything into consideration. This is why I think interdisciplinary cooperation is so important. I'm now going to turn to Helen Dart, who is a Society of Master Saddlers Master Saddler and an SMS qualified saddle fitter, who has a huge amount of experience in fitting saddles to young horses. Helen.
Thank you very much, Jane. Hello, everybody. The young horse back is a very, very important area. They are hugely sensitive. They are virgin territory. And often these are areas that are very sadly neglected. When we're starting to introduce our horse to tack and equipment, we are programming the muscles to accept us. We're programming the horse to accept us. So everything we do needs to be micromanaged again. And so often this is neglected. We often use things that we've had and we've used for a very long time, but everything we use on these young horses will relate on later in life. The first girth will bruise the fascia when you put it on. So when we start off with our young horses and conditioning their muscles ready to take us and programming them, we want to make sure that we start off with a well-fitting roller. Again, an area often neglected. Dr. Russell McKenney-Guar has just done a recent scientific paper on how the roller affects the way the horse goes. And also he found in his study, one of his highlights was that high pressure is found around the thoracic vertebrae 11 and 12. So we want a roller that is not impeding the spinal processes, that the pads are sitting either side, it's correctly positioned, and also that the girth is the correct shape and type for our young horses. If your young horse has a forward girth groove, the photo here, this young horse doesn't particularly have a forward girth groove, but again, if it has a forward girth groove, that the girth perhaps is shaped and the correct shape for the horses, the young horse's conformation. Because by breaking our young horses and introducing them, we're trying to desensitize the flight and fight reflex. Jane. So here we have a young horse, totally different conformation, a more defined wither, lacking quite a lot of top line. Again, this actually is a 3-year-old. So with this horse, again, the padding on the numnah to start it off would be very, very important. And at this point also, we need to look at the bridle. Just as important nowadays as saddle fit. Many of you, again, will have read a lot of research on bridles, and now we have a lot of bridles on the market, anatomical bridles. And again, another thing that is important that we have it to fit, the bit, the dentistry, all these things, micromanaging these young horses to get their optimum performance. All of these things can affect their gait. So we want to get this right. We don't want to leave it to chance. Jane. So just recapping, lunging the young horse, we've got increased spinal pressure under the roller if we don't use adequate padding and good padding. The girth will bruise the fascia until the horse is used to that sensation, and the properly fitting bridle, so with a fitting bit, horses, young horses, again, making sure their mouths are checked, they haven't got wolf teeth, etc. So we are eliminating all the things that potentially can go wrong. Jane? Here we have a young horse with a nicely fitting saddle, nicely fitting tack. The rider is sitting in a good balanced place, and this is basically what your qualified saddle fitter is going to help you do. When we first start off working with young horses, often we can't see the rider on them to start with because they haven't got to the stage in their training that they're accepting the rider. So we may fit the saddle in a stationary element, but when that young horse is ready to get on and starts to take our rider, we need to see the rider on the horse. It's so important that your saddle is checked in a dynamic form, not always in a stationary form, because young horses will change so much in their dynamics, particularly under the rider. But a nicely balanced picture. Thank you, Jane. Horses will change shape, particularly young horses, quite often in a sort of 6-week ratio. So your regular checks are very necessary. And again, quite often the young horses are tacked up with a saddle that you may have in a dusty corner. And again, you want to make sure that these saddles fit these young horses, because it is so important not to set up the future problems. Saddle fit is dynamic. It is that horse going. We want that horse and rider to be in the best way they can go. Thank you, Jane. So an experienced saddle fitter will help you assess the conformation. We have young horses that are a little bit croup high, a little bit angular through their withers. They're perhaps lacking a little core muscle. They can be round, have no withers. Their growth rates change. Suddenly they're uphill, they're bottom high, then they're downhill. All very challenging, but so important for us to get that rider in that balanced place so that young horse can go to its optimum, maximum effect. Jane? saddle fitters always should assess the saddle, the horse under saddle. So immediately we get you on board and you can have a little walk and trot. The saddle again should be assessed. And again, ongoing assessments. What we want for people to do is get a really good relationship with their saddle fitter. So you can pick up the phone, you can discuss things. It's about the micromanagement. Jane? Yes, so we're back to the experienced saddle fitter again with the different confirmation things. And as I reiterate, it is challenging. So often when young horses are croup high, we might get a little bit of scapular pain. The rider will lean forward. We'll have more forelimb loading. We'll have more unbalanced with our young horses. Again, when we going back a stage with the backing process, when we're leaning over them, we want to make sure that the person leaning over is supported so that we haven't got to pull on that saddle one way or other. Again, Dr. Russell Mackenzie-Garr did a very good thing on mounting the young horses and how important it is to perhaps mount from a block, a nice high block, rather than pulling the saddles on them. So the saddle must have stability. All horses like their saddle to be in balance. They want to feel the saddle nice and still. We don't want that flight reflex activated, basically. So the saddle should be checked and rebalanced every sort of 3 to 6 weeks, every 3 months, every 4 months. Get that working relationship with your saddle fitters. Jane?
Thank you very much indeed, Helen.
Thank you.
The points with regard to young horse development are: this is an ongoing, dynamic situation. Regular appraisal by the carer, veterinary surgeon and nutritionist are essential. The farrier must always examine the horse statically and dynamically, and the saddle fitter must always examine the horse ridden. So, ladies and gentlemen, let us be ahead of the game. Always consider equine evolution with everything that you do. However, we have modified the horse both physically and mentally to our own ends. Such modified horses will no longer be capable of living in the wild. I recently had a discussion with my great friend Professor Steve May, who is Head of Education and Vice Principal of the Royal Veterinary College, and we concluded that we all have a duty of care to the modern day horse, and we should always support and uphold the social license to operate in the horse. Thank you for your attention. We'll have a few seconds pause and then go on to the question and answer session. The question and answer session will take the form of a panel discussion. And here we have the 4 presenters, as you've just heard. And so Lucy Hyde-Thompson, it is now over to you, please.
Thank you, Jane. The questions are coming in thick and fast at the moment. So I hope I managed to address them all to the right people. Jane, if a problem is detected early and appropriate treatment is given, i.e. weaning early, cutting down food, limiting exercise, in your experience, approximately what percentage will come sound, and will they stay sound?
Well, thank you very much indeed, Lucy. I'm a lucky person. I'm a lucky vet because I've had experience of almost 20 years now with the futurity, and therefore I was working out the other day, I must have seen in the region of between 5,000 and 6,000 horses to assess them in the way in which we normally do, together with the nutritionist, the farrier. I can say that without any shadow of a doubt in my mind that if a 3-year-old presents and gets a good veterinary score, I will feel confident that that horse is likely to have a long and free from lameness career. So the answer is get it right at the beginning and keep it right. Thanks, Lucy.
Thank you, Jane. Helen, how do I find a qualified saddle fitter?
Yes, thank you. The Society of Master Saddlers, they have a website. The qualified saddle fitters are now very highly trained. The Society set up this exam, City and Guilds exam, 25 years ago. So if you choose to use the Society of Master Saddlers qualified saddle fitter, you know you're going to get someone who's highly trained, highly dedicated and very, very professional. But the Society website will give you all the details. They're all there. The Society also produce a booklet every year with every qualified saddle fitter there on the booklet.
Thank you very much, Helen. Emma, I have a lovely 2-year-old with no issues. She's now out at grass with feed balancer. Should I be giving her anything else?
No, not necessarily. I think as long as she's maintaining adequate weight and condition, so she's not underweight in any way, then the balance is absolutely fine. As long as it's supporting correct growth and development. The only thing that I would suggest is be aware of your pasture or your hay or haylage. So again, sort of looking at the quality of your forage that's available. Certainly at the moment, obviously the spring grass is coming through and things like your protein levels, etc., are particularly high. But as we move into summer, autumn, and then winter, your pastures will obviously change. So you may need to sort of look at adjusting your balancer type, whether it's just an ordinary balancer or maybe a stud balancer, according to forage quality.
Thank you very much, Emma. I've got a question for Dean and Jane from Caroline Hunt. I have a 5-year-old mare who's a big loose mover who is shod in front only. We are watching her foot balance. Is there a point when you think it's preferable to put shoes on behind? Do you prefer toe clips or side clips on front shoes?
Well, thank you, Lucy. I think both Dean and I will be happily answer this. The most important thing is to remember that the hind limbs are more important than the front limbs. The hind limbs, as we mentioned, are attached to the spine, whereas by the bony attachment, whereas the forelimbs are not. The hind limbs in the developing and particularly larger horse are extremely important for supporting the horse and his propulsion. Therefore, I'm quite keen to have a horse shod behind as soon as it is appropriate, so long as the feet are balanced, the toes are not too long, and sufficient length is given at the heels. Dean will comment with regard to the type of shoe that should be put in place. Dean, would you like to have a comment on this?
Yeah, sure. So when it comes to hind shoes, the main aim is to support the actual hoof capsule. A lot of people think we just fit a shoe to the foot, but we need to think out the box a little bit more and think, where would this shoe need to go to support the whole hoof capsule? Because if you've got a nice sturdy base, it's going to give a sturdy footing all the way out the horse's limb and through to the back and spine. And when it comes to toe clips and side clips, this gets spoke about quite a lot. That all comes down, to me, it all comes down to the shape of the foot. If you have a really horse with a long rectangular foot, by putting a toe clip on, you're just not going to get the shoe back enough to support the back part of the foot. So that is when we can put side clips on, the foot can slide under the toe and it can allow a little bit more support out of the back. I'm putting toe clips on. Toe clips, I always try to get to toe clips. I never stick in one shoe more than the other. And it all depends on how the foot changes as the horse grows and moves on through its ages.
Thank you. The second part of the question was whether or not the horse should be shod in front, I think. And I have a number of young dressage horses on my books which are shod behind, but not shod in front, because we need to continue to rebalance the front feet. And this is quite doable, so long as you have an appropriate surface upon which to ride the horse. It actually works quite well because you're supporting the hindquarters and you're managing the forefeet. I hope that answers your question. Lucy.
Thank you, Jane. I'm going to bombard Emma with questions, if that's all right, for a little bit. You're up first. Emma, Sarah would like to know, what percentage protein do you suggest in the mare's diet for months 1 to 9? Previously, we've only increased to approximately 16% in the last 3 months.
Okay, yeah, so most stud rations, when you're looking at things like a stud mix or cube, will typically have around 15-16% crude protein typically, hence the 16% there. I would recommend getting them onto a stud ration straight away, quite frankly. So again, aiming for around the 15-16% mark, purely because your forage, again, is going to be very variable. And during that 1 to 9 month mark, it's likely that the forage is, particularly if you're looking at grass pasture, is going to be relatively low in protein, particularly coming obviously into autumn and winter. So actually getting them onto a stud ration at an early stage, from my point of view, is a much more beneficial way of ensuring that the diet is not short in protein and any of the other vitamins and minerals. It also allows for you to keep the diet sort of relatively similar throughout. You may need to sort of adjust calorie intake, so looking at a balancer initially, then maybe moving on to a cube or a mix to increase calorie consumption in the latter stages. But a stud feed really from day one is what I would suggest.
Lovely, thank you, Emma. Tracy has a question for you. My vet has warned me about overfeeding foals, stating this is storing up problems for the future. Is this correct, please?
Yeah, I think we've got to be careful about what we mean by overfeeding. Overfeeding from a perspective of energy or calories, whereby the foal is maybe too top heavy and overweight, absolutely we do have to be careful. We know that increasing the energy content or the calorie content of the diet when it's not necessary will increase growth rate unnecessarily and therefore create obviously developmental problems. Equally, we need to be ensuring that the micronutrient levels, so there's enough quality protein or amino acids, as well as your vitamins and minerals, are being received by the foal in order for correct growth. So looking at things like a balancer, for example, in this instance is ideal, particularly when you have a foal that is either growing a little too quickly or is too top heavy, or typically what we class as a good doer, because we're enabling them to have the right nutrients for supportive growth without actually overloading them or creating that disparity that we were talking about earlier.
Thank you, Emma. Megan would like to know, what would be recommended for a nervous, sharp 4-year-old feed-wise? Are calmers advised or to be avoided?
Okay, I think initially I would try and get the diet balanced as much as I can. So making sure again that your vitamin and mineral levels, etc., are correct. But you need to basically be looking at avoiding sort of high starch, high sugar based rations. So anything whereby you have a higher level of cereal, such as things like a stud mix, for example, or even a stud cube, depending on the product, is probably best avoided. So you could look at things again like your balancers that are typically low starch, low sugar. If you require calories, then you can bulk out with higher calorie fiber sources, such as things like your alpha plus oils, things like your unmolassed sugar beets, for example, are good options in order to boost calories if required. So try and avoid high starch, high cereal based rations initially. If I suppose that is still not getting what you want, then you can certainly try a calmer if necessary and see whether that helps also.
Thank you very much, Emma. We've got a question from Leanne. How should we feed our horses? Hay nets, on the floor, hay bars?
Yeah, that's a good question. I think it really depends on the circumstances. If we can feed as naturally as possible, then ideal. So if you can feed off the floor, fantastic. I know from a physiotherapist sort of point of view, I think that's the most natural way and you're less likely to get issues. However, if you're having to restrict or limit forage, if you have particularly good doer, for example, then possibly a hay net is maybe the way forward. It gives you possibly a little bit more flexibility. But if you don't have that as an issue, then yeah, off the floor is ideal.
Lovely, thank you, Emma. I'm going to answer some questions for Dean at the moment. Dean, my farrier does not like to do any trimming in the first year unless there's a real need, such as if there's an imbalance. What are your thoughts, please?
Okay, so I think my personal view on it, I think it's really important to assess the feet as soon as you possibly can, because like we said in the presentation earlier, there's a lot of weight gain, a lot of things changes in the first year. So I think it's really important to try, and there's always something to change because feet are constantly moving, going on the surface, environment, seasons. So I think Jane would back me up on this. Jane, would you say that it's important to keep on the trimming as soon as you possibly can?
I absolutely agree with you, Dean. One may not necessarily trim every time one sees the foal, but it's essential to at least see it and assess it. Every animal is different. Every horse needs something differently doing to it, but we must be aware and meet any eventuality. And we know, the two of us, by a minuscule change in foot balance can make a big difference to the foal's limb. I wonder if you'd like to refer to that, Dean, because that's something we've noticed very much working together, isn't it?
Oh yeah, there's been times where Jane and I have walked the foal up and down and seen it, and we're looking at the very finer details, how the foot's landing, if it's toeing out, toeing in, and we've picked the foot up, just gave it literally a couple of files, then walked it away, walked back to us, and we both looked at each other and just went, that's made a difference. That's what we wanted to do. So a couple of pushes of the rasp can really make a difference when it comes to the young stock. So I think if you can trim, just look at the feet on these young foals, and just if they need adjusting, adjust them.
Thank you very much, Dean and Jane. Dean, another question for you. Is a horse ever too old to start changing the wrong balance of a foot? For example, an 8-year-old?
Okay, so the quick answer to that is to no. As I said before, the hoof capsule continuously moves under forces, and not only in young stock but in the older generation of the horse, it will still move in different directions, and we also need to be aware of arthritic changes, which can also manipulate the hoof capsule. So the answer is yes. Feet can still get out of balance, but with regular farrier visits, I think us as farriers, that's our job, to try and keep the hooves as symmetrical and as balanced as we possibly can through the life of the horse.
Another question for Dean and Jane. How significant is a slight toe-in posture in a rising 4-year-old? Will this straighten as the chest expands?
Well, as we mentioned earlier, the most important thing is that hopefully the two limbs are the same. If it is just one limb, it needs more addressing than if it is both limbs. You're absolutely correct. As the chest expands, the toe-in conformation is less obvious. Nevertheless, a lot of people have had over the years horses which are severely toe-in, but at the end of the day, it is usually the demise of the horse. In other words, they develop lateral collateral ligament strains, damage to the outside of the fetlock, and splints on the inside. And I'm sure, Dean, you would probably agree with me, I think, on this, would you not?
Yes, definitely. I think we need to, our job is just to try and keep these limbs as straight as possibly from day one. So any deviation we need to try and address, but we have limitations. We need to understand the breed, type, and all these other variables that we need to take into consideration. So it's not one rule, it's one rule for every single job. So we need to be aware of that.
Thank you very much. A question mainly for Dean, but Helen, I think this is partly for you. If a horse is ridden in both hoof boots and unshod in the school, would you expect the horse to change its way of going between the two? And should we then check the saddle fit whilst booted as well?
Okay. Helen, I'll take lead on this.
Yep.
It's that's a good question. I've never really thought of, would it make a difference? I guess it would, because the boot is an extension of the hoof, so it's essentially making it slightly larger, slightly bigger, and on a surface it could potentially make things slightly maybe worse or not. I'm really unsure, but That's a really good question, but Helen, would it affect the saddle fit at all?
I think it possibly could, to a slight degree, and possibly if I was going out to check that, I'd probably see it trotted with the boots on and without, just to make sure that the saddle was in balance with both. I mean, it would probably be fractional, but equally, every time you change tack, the horse will find a slightly different balance. So it possibly could, couldn't it? I've never really thought about it. So yes.
Thank you both very much. I'm just trying to scroll to the one question I had. Helen, how would you alter a saddle on a horse with asymmetric shoulder development that has worsened over 9 months?
This is very interesting. I think our knowledge has developed over the last 10 years how to help these horses. And now with the use of shims, we can perhaps help keep horses straighter. But when you start using shims and pads to help these horses, you must be very, very aware they have to be constantly monitored. It's no good popping a pad or a shim under it and never seeing that horse for another year. Because as I said earlier, horses can change their muscular atrophy, they can change their muscular development, and they roughly in a 6-week period. And sometimes with these young horses, it's quite easy to use a shim. And I would probably use a shim over flocking, because the flocking is a little bit more difficult to take out and keep putting in constantly. So a shim is quite an easy, nice way of helping that horse become more level. And that's what we're looking for, that level development.
Thank you very much, Helen. I've got a question from Susanna here. Do you believe that performance is a better indicator of pathology than poor conformation? At least it's not directly addressed to Helen, so do feel free, anyone, to jump in.
I think, Lucy, this is my pigeon, really. Performance will be directly related to conformation. This is a very old adage, and people who have horses with weaker conformation will say, well, my horse won Badminton with weak conformation, so what is wrong with that conformation? The point is, if you refer that to other horses, more horses, had they had good conformation, are likely to do well. So I'm afraid to say it does not stack up that a horse with poor conformation will necessarily do well. A horse with good conformation will do better than a horse with poor conformation, so long as that horse has the correct mental attitude, is correctly trained and correctly ridden. So you see, going right back to the beginning, there are so many different facets of bringing on the young horse. And this is where, when we all work together, it is such a huge advantage. I wonder, Helen, or Lucy, I wonder if you would mind if I asked Helen a question, please.
By all means, Jane.
Helen, yes. So many of my clients ask me, I really don't want to put the old saddle that I've used for the last 30 years on my youngster. Frequently, the saddles don't fit. Often they've got broken trees. And as you rightly said, this is virgin territory and damage can be remembered or will be remembered.
Will be remembered.
Just advise us, please, what sort of saddle that you'd recommend that we put on young horses whose backs change so quickly?
A lot of young horses maybe are going to be a discipline specific. So, you know, whereas a lot of people want a general purpose saddle, but if they are going down a certain discipline route, it might be best to start off with the saddle that is going to go onto that discipline, so that they learn to take their rider in that balanced position for that discipline specific. Nowadays we have so many saddles with interchangeable gullet plates. They're not infallible. We really still want to have that saddle with the correct tree shape for that horse's back and conformation. And dare I say it, that the saddle fitter does fit the saddle to the horse that they see on the day. None of us have a crystal ball to how that horse is going to change, but obviously with an experienced saddle fitter that is able to flock and adjust those saddles. So for me, a flocked panel is better. a nice soft wool that is going to accommodate that young horse's muscles underneath and allow that horse to come to its maximum development.
Thank you very much. Very useful. Lucy.
Thank you very much. I've got a question for Helen and Jane here. I called the vet out to remove the wolf teeth in my 18-month-old. He advised there was no need to remove them unless they caused an issue. This was opposite to the advice from my dentist, who said to remove them before the young horse was bitted. Who was right? The horse is now 22 months old and still has wolf teeth.
Aha. Well, I'll take this question. I'm afraid to say I do not like to take sides, but in my view, wolf tooth, without question, should always be removed. Full stop. Easy answer.
Thank you, Jane.
One more question, Lucy, please.
Helen, like Jane explained the benefits of leading from both sides, would it be beneficial to mount from either side from a mounting block?
Yes, it probably would. But most of us like going on the near side. I think we get so programmed ourselves to get on that side, and we become very one-sided, the same way as our young horses become one-sided. So I think, you know, if we were all beautifully athletic, yes, it would really help to be able to get on both sides and our young horses to take us both sides, because there is an immense pressure at the front on the scapula on the right hand side as you mount. But this again can be minimized by using a mounting block, and I would always recommend nowadays that everybody uses a mounting block, and not a little one that you're still pulling yourselves up with, but a nice tall one that you can really just virtually step on your young horses on.
Thank you, Helen.
Thank you very much indeed. Lucy Hyde-Thompson from Business Integrations, thank you very much indeed. I think we all enjoyed the panel discussion. I'm delighted to say that we've actually have over 400 registrants for this, and we have had over 50 questions. So between us, in due course, we will try and answer the questions for you. So it comes to me now to say thank you very much indeed to our sponsors again, of course. And I would like to thank you, of course, to British Breeding, who are the people who these days run the Futurity and the British and the Bridge events, as well as Stallion events and many other showcases. Bailey's Horse Feeds, who have been hugely supportive to me for many, many years. They assist me at the Futurities and they have put this presentation together and done the graphics. The Society of Fast Travellers, whom have grown from strength to strength over the last 25 years, although they're now over 50 years old. And as many of you may know, that I'm very fortunate to be in their position, in the position of being their veterinary consultant, following my late husband, Stuart Hastie. So, of course, much of this presentation is due to his advice to me over many years. And lastly, I would like to thank PKW Events, who have been extremely supportive to us. And I'm just going to leave this slide up for a few moments so that you can read it and take down their Facebook details. And of course, this event will be recorded for you, for each and every one of you. And if you have missed anything or you do not have time to make a note of PKW Event Facebook, then you will be able to get this at a later date. So from us all, I'd like to say thank you very much indeed for attending, and goodbye until we all meet again, I hope, very soon. Stay safe.
Good evening, ladies and gentlemen. Amazingly, we had 440 registrants for this webinar, and we've had 85 questions. And that's a little bit beyond the wit of this panel, let alone man to answer all in one go. So we've reconvened tonight, Lucy and the four of us, to answer some more of your questions. We hope we'll have covered most of them. Tonight we're going to try and answer each 4 questions of the ones that seem to be repeating and common thread. And there are some other questions which we individually will attempt to, or we will reply to you by email. Nevertheless, if you feel that we perhaps have not covered everything you wish to know, please email us and we will endeavour to do our best for you. And thank you very much for joining us. So, Lucy, over to you, please, if you can determine the first question.
Thank you, Jane. And the first question is to you. Is there a significant genetic influence on foal conformation, i.e., should we discard breeding from animals with poor conformation?
Thank you, Lucy. That is a very, very good question, and the answer is most definitely. Of course, we're not just talking about the foal, we're talking about the mature animal and how suitable that will be for the purposes for which we want, and also for the horse's welfare too and its longevity. As we mentioned in the lecture, any horse with an angular or rotational limb deformity by the time it's 10 is quite likely, or almost will be, clinically lame if you look at it carefully. Now, there are some conformational defects or abnormalities which do have a recognised genetic influence, but there's no question about it whatsoever that there are a large number of familial traits such as toe in, toe out, poor shape of the hind legs, etc. And I would say for many, many years, we've all said we should only breed from horses which have finished their career free from lameness and have good conformation. So thank you for the question.
Thank you, Jane. Cassia would like to know, at what age is it most useful to obtain baseline x-rays or scans? I'm keen to give myself as much information as possible early on to help manage any future issues.
Thank you, Lucy. This also is a very good question. We know that many OCD lesions they may be present in the foal, but by the time the youngster is a year, anything that is likely to disappear will have gone. And therefore, the prudent time to x-ray youngsters for skeletal defects is at the end of their first year, or as they're coming into their second year, before you start to work on them, before you introduce them to any training of fitting a roller, etc. You really do need to know, both from their welfare point of view, which of course is absolutely paramount, and from your point of view with regard to the business aspect of this. You do not really want to be producing a horse which has got a skeletal lesion that might interfere with his gait at a later date and cause him discomfort, or you lack of success. So the answer is approaching their second year.
Thank you, Jane. Dean, Laura would like to know, assuming no obvious problems or deformities of your newborn foal, when would you as a farrier first want to see them?
Thank you, Lucy. So as a farrier, I even though there might not appear to be any problems or deformities, obviously we as farriers are trained in looking at horses' gait, hoof capsules and any problems. So I think it's really important to get to see a foal as early as you can, potentially within a week, just to get your eye over it and just to see from a farrier's point of view if there are any issues, because you know, a couple of files here and there can always make a difference and try and improve the foal, and we just need to continue that. So the answer to the question is, you can get your farrier to look at the foal within a couple of weeks' time, just to make sure and give you peace of mind that everything's growing as straight as possible.
Thank you, Dean. I have another question. I have a yearling filly whose feet are regularly trimmed, but they have become pretty ragged in this dry weather and have started cracking and chipping. Is there anything I can do to help this? she is fed a daily balancer and is on good grass?
Okay, so that's a good question. That's a combination of speaking to your nutritionist, making sure that you've got everything going in correctly, and also from our point of view is just to maybe shorten the intervals between trimming, because yeah, the ground has gone really hard and it has made the horses go quite sore and the feet have started to crack. So the only thing from a farrier's point of view is if we can just bring the trimming a little bit sooner, just take a week off the interval, and hopefully that will prevent the cracks from getting worse or appearing.
Thank you, Dean. Emma, in regards to nutrition, what is the best method for measuring a foal and onwards growth rate? Also, what is an ideal supplement for a mare in foal?
Brilliant. Thank you, Lucy. So to answer the first part of the question, we want to be looking at sort of weights. So if you've got access to a weigh bridge, that would be fantastic, although many of us don't. So from that then, something like a weigh tape would be the best method, although they're not 100% accurate with measuring weight. Keeping a constant log with the same person weigh taping, using the same weigh tape, preferably at the same time of day and possibly the same day if possible, means it's a little bit more accurate. And ideally sort of logging that on a weekly or bi-weekly basis so that you can log sort of the growth curve of the foal is a really good way of doing it. If you want to have a look at sort of things like growth charts, there are many available to you. We do have one on the Bailey's website if you want to go, and you can download that and therefore then log body weight, etc., which can be useful. Also combining that with body condition scoring as well. So it's important to look at the weight, but also looking at sort of how much fat also your youngster is carrying, so that you can combine the two and monitor obviously any changes sort of frequently. The second part of the question really very much depends on the mare in question. So if you have a mare that tends to hold her weight very well, so is a very good doer, survives off mainly forage, then something like a stud balancer would be the most appropriate sort of method of feeding her to ensure that she's getting the vitamins, the minerals and the quality protein without the calories. If she struggles to maintain and hold weight, then you may need to be looking at a stud cube or a stud mix that provide a few more calories as well as the correct level of nutrients. With respect to a specific supplement, if the base ration is correct and you're feeding the stud ration correctly for body weight and for stage of pregnancy, etc., then there should be no reason for you to further supplement unless there's a specific problem.
Thank you, Emma. Lizzie would like to know, can stomach ulcers be caused by weaning?
You can certainly get stomach ulcers in the foal, and absolutely the weaning process can be obviously quite a stressful period for the foal. So absolutely ulcers can be an issue at this time. What we would tend to do is to encourage a gradual transition onto a suitable stud diet, so that before the foal is obviously taken away from mum at weaning, they're already introduced to a correct stud balancer or stud cube or stud mix sort of ration. So they're used to having their own bucket feed. They hopefully are taking and consuming forage quite happily, so that when actually you come to weaning the foal, it's much less stressful for them. So what we would typically recommend is ensure that the foal has adequate levels of forage, so that they're continuously eating, and ensure there's plenty of water also. Any bucket feed that you are feeding needs to be ideally sort of fed in small proportions throughout the day, and try and choose sort of a lower starch, so therefore lower cereal-based product, such as a balancer or possibly a cube or a blend, so that we can help to sort of reduce obviously the acidity within the stomach.
Thank you very much, Emma. Helen, question for you from Kerry. At what stage in the horse's education would you recommend getting a saddle fitted? Before ever placing a saddle, but following working in a roller, or after becoming accustomed to a saddle?
Thank you, Lucy. Very good question, and a difficult difficult one in some respects, because it's always difficult with budget with people. But in a perfect world, if we could all do it, I would always recommend having the saddle properly fitted before you even got on it. So once you've done your lunging and your roller and all accustomed to that, that you then had a saddle correctly fitted in balance, so that you could then start to lie across it, walk around lying across it, and do all that part of your braking process, maybe sitting on it, knowing that you're not going to set up any problems. But I would then suggest that once the horse is ready to go and work on into trots, you had the saddle checked again. Because, as I've said earlier, this young horse is going to so change, and he will change even with that lunging process. So it's a real ongoing thing, but it does always depend on people's budget, which I'm very conscious of. But work with your saddle fitter, get a dialogue going, and that's the main thing. Keep talking, pick up the phone, talk to your saddle fitter, open the dialogue. Thank you.
Thank you, Helen. Megan would like to know, are anatomical bridles any better than a traditional Cavesson bridle for a young horse?
I think some really incredibly exciting developments have been happening with bridles. We've realised that bridle fit has been one of the areas that's so often neglected. You go out and they've got tight nose bands, they've got very small brow bands, headpieces being pulled forward onto the base of the ear. Our knowledge of bridle fitting has increased, and the Society of Master Saddlers last year started a work in progress of making a qualified bridle fitting exam, which is now going ahead. It's a City and Guilds qualification. So if you have a young horse and you're worried about your bridle fit and maybe an anatomical bridle is the way forward, now we have qualified bridle fitters out there with a City and Guilds qualification. Every horse is individual with its head conformation, the same way as it was with its back conformation. We know that a badly fitting bridle may affect gait. There's been a lot of research on this, a lot of very exciting scientific papers on it, all available on the internet. Have a read. Thank you, Lucy.
Lovely, thank you, Helen. Dean, back to you. Sarah would like to know, do you walk up or video every horse you shoe, or just the tricky ones?
Okay, thank you, Lucy. So in an ideal world, we would love to walk up and video every single horse. But as you know, there's time constraints, but the main thing is having a flat surface to walk the horse on. A lot of people think you can walk a horse up a stony gravel with a slight camber, but you will not get a true reading of how that foot's landing. So if you can find a nice flat spot, I would always recommend walking your horse up, because you can just film it and show the customer yourself through the phone, or share the videos as well. And it's just really good to give that to your customer. And also you can store it and go back to it in a few months down the line and see the progress on each horse. So I would always try and walk the horse up if I possibly could, but it also depends on how flat your surfaces are around your yard.
Thank you, Dean. Jancis would like to know, do you think it's possible to appropriately support a young sport horse's foot without shoeing it? Okay,
this is a good question. Thank you. I think my personal opinion is I think you can get so far with a young horse being barefoot, but there will become a point where you're going to need that extra support, i.e. from behind. So we all know that a well-fitted shoe offers more width and support and a larger base for the horse to push from. So not only does it benefit because all the other horses will have shoes on, you'll be at a disadvantage if you don't have shoes. And also, if the horse does become footsore or is footsore, I found in previous shoe-ins where horses haven't had shoes on, but as soon as I put back shoes on, they've almost got another gear. So it almost leads to the horse to have more confidence or no soreness. And another reason for when you come into jumping and you need extra grip on grass, a barefoot horse just can't compete against the horse that has stud holes and shoes on.
Thank you, Dean. Emma, back to you. Caroline would like to know, she has a 2-year-old which has just had a growth spurt behind. Normally he's very even in his growth, but is now ribby. What should I feed him, please?
Thanks, Lucy. It really depends on his current diet. I suppose the initial recommendations would be to make sure that you're feeding the right type of product to your horse currently. Check that you're feeding the correct recommended levels by the manufacturer. Following on from that, you may wish to introduce a higher calorie chaff, such as an alfalfa with added oil, for example, or possibly look at a sort of a beet or soaked sort of beet sort of type product in order to provide additional calories alongside your ration. If that's still not giving you quite enough, then you may need to look at changing your base ration onto a product that's higher in calories. So, for example, if you're on such as a stud balancer, which is relatively low in calories, you may need to move up to a stud cube or mixed ration, or combine the two if necessary. Or possibly looking at a conditioning feed. At 2 years, we can feed sort of a more mature ration, so a conditioning feed is absolutely fine. You can also top up with straight oil, although if you're feeding over about 100 mils per day, you will need to consider further antioxidant supplementation, or there are oil-based products on the market that you can supplement with also. And obviously, most importantly, is to make sure that they are getting ad lib good quality forage alongside your main bucket feed to ensure that we can establish calories and nutrients and a balanced diet.
That's great, thank you, Emma. Nicola would like to know, there is a lot of marketing for balancers. Are they proven to be better for a broad spectrum vitamin mineral supplement for a young warm blood horse? In nature, horses have a period of less nutrition in winter with a glut of grass in summer. Are we wrong to attempt to maintain even nutrition all year round?
Right, okay, so let's talk about balancers then initially. There's a difference between balancers and a vitamin and mineral supplement. So your vitamin and mineral supplements purely just provide you with vitamins and minerals, whereas a balancer will provide you with vitamins, minerals, as well as your quality protein or essential amino acids. So they are doing two different things. I suppose the main thing to consider is the forage quality that you have available to you. At this time of year, obviously the grass is providing us with a large amount of nutrients, with things like your protein levels, for example, being relatively high as the grass is growing. However, it very much depends on how much grazing you have available to your animals, the type of grazing you have. See, there are other variables such as weather conditions, the environment, etc., which will all sort of basically affect the quality of the grass that you have available to you. It's also worth noting that obviously as we progress into sort of summer and obviously autumn, winter, the grass quality with respect to your nutrients, typically things like your protein and your vitamins and minerals, will start to decline. So our forage is very much variable, and particularly when you're looking at grass in particular, it very much fluctuates throughout the year. So although currently the protein levels within our grasses will be relatively high, and assuming that your animals have good access and plenty of grass available to them, then you may well find that the protein levels are being met currently, and therefore vitamin and mineral supplements may be adequate. However, because we know that the levels fluctuate so much, a balancer is a more consistent way of supplying not only your vitamins and minerals, but also your protein. And your protein is key for tissue development. So if you've got a young growing animal whereby maybe the protein levels are deficient because your forage is not providing adequate levels, then that could potentially lead to compensatory growth later on, or possibly sort of increasing the risk of your developmental issues from occurring. So a balancer, I suppose, is a much more consistent way of feeding your horses, in my opinion. The second part of the question, with respect to nature, absolutely. I think it very much depends on what you're looking at with respect to nutrients. Are you looking at calories and therefore feeding an overload of calories potentially through the winter? or are you looking at keeping the nutrient balance? So are we looking at encouraging protein, vitamins and minerals in the diet during that time? We know obviously that, yeah, your grass from a nutrient perspective is certainly much lower through the winter months, and if we're feeding our horses haylage, so dried forages, the nutrient levels will be significantly lower than what your grass is going to provide. So I think there is nothing wrong with the calorie content certainly being lower throughout the winter months, and for those that are good doers and hold their weight incredibly well, actually a deficit in calories throughout the winter is a good thing so that they can lose weight in preparation for the spring grass, etc. With respect to nutrients, I do think it's important that we are maintaining the correct balance of protein, vitamins and minerals, particularly if you've got animals that you're still exercising and working or competing on throughout the winter months. Obviously, we're going to need to supplement their diets accordingly. And also when you have a brood mare, for example, that is in foal, or you have young stock that are growing and developing, then obviously their requirements for protein, vitamins and minerals are also going to be reasonably high at that time. So I think it depends on how you're looking at it. Calories, I would have no issue with sort of being obviously lower throughout the winter months, but I think to maintain the correct nutrient balance is still very important.
Thank you very much, Emma. Jane, Kate would like to know, if a foal has shown physitis for a short time, is there a disposition to have problems later in life?
Thank you, Lucy. This is a very useful question because it demonstrates the importance of communication and cooperation between the people that look after youngsters. The other word is epiphysitis. The epiphyses are the growth plates, which you will see at the top of the knee and at the top of all four fetlocks. But also there are epiphyses or growth plates within the spine as well, which of course you can't see. Now, the growth plate can be modified, and it can be modified by a variety of things. Loading, i.e. body weight or hard ground. Local loading by a angular or rotational limb deformity or an imbalanced foot. Therefore, it's beholden to the carer, the farrier, the veterinary surgeon if necessary, and the nutritionist, all to work together, all to communicate and cooperate with regard to this problem. Most interestingly, with regard to the futurity, where we generally examine between 400 and 600 youngsters a year, which we've done now for almost 20 years, how interesting it is that epiphysitis seems to vary across the country depending on the hardness of the ground, the age of the foals, the amount of rainfall, the composition of the grass and consequently the mare's milk, in particular any rotational angular limb deformities, and also local problems with regard to foot balance. Therefore, if a foal has a mediolateral foot imbalance, it's more likely to get an epiphysitis on the inside or outside of one limb than in a horse with good foot balance. So essentially, if the foal is maintained with a good structure of the limbs and the epiphysitis pretty quickly disappears, then there is no problem. However, I was alarmed at a sports horse meeting a few years ago. A very erudite lady said to me with regard to her thoroughbred young stock, oh, we just chuck them out in the field and we let them get on with it. Well, nothing could be worse. Really and truly couldn't. And it's an accident waiting to happen if you do that. You do need to monitor these youngsters very carefully. And the answer to your question is, Kate, no, there should be no problem if it's only a moderate epiphysitis and it's well managed. Thank you for the question.
Thank you, Jane. Natasha would like to know, what is the benefit or otherwise of a young horse trotting on the road?
Thanks, Lucy. Again, this is another good question. Historically, hunters in years gone by have been got fit by what is called a working trot or a hound jog, which is a slow trot on the road. And of course, it did get them pretty fit, but again, it caused jarring of the joints, particularly if the horse was unbalanced, or more likely the rider was unbalanced. Now, work from the States, from Professor McElraith has shown that in young thoroughbreds, a small amount of trotting on the road, i.e. 50 to 100 meters, is more than sufficient to establish good bone development. And in fact, it is indicated. And that is probably all that you need to do every third day. Nevertheless, the thing that is really, really important in young horses is cross-training. Now, the old-fashioned word for cross-training is what we all know, which is hacking out, riding across country, so that the musculoskeletal development of these horses adapts to all terrain, not just to being ridden round and round in circles on an arena, where unfortunately the repetitive strain syndrome of those sort of problems, of those sort of exercise, manifests itself later in life, as would consistently hammering away on the road. There's a quote, is there not? It's not the hammering on the hill, it's not the hunting on the hill that hurts the horse's hooves, but the hammer, hammer, hammer on the hard, high road. There we are.
Thank you very much, Jane. Helen, Aileen would like to know, how do elastic girths imbalance the saddle?
Yes, this is a good question. Horses very much like stability, as I've said earlier. They like to feel that the saddle is very stable. And whilst there are good uses of elastic in girths, quite often the girth elastic can be too stretchy and allow the saddle to have too much movement. Some horses like elastic, but also one of the other problems with elastic is, particularly if it's of the very stretchy variety, the girth gets over tightened, and that in turn can start to lead to more problems. If you yourself as a rider have perhaps got arthritis in your hands or something, you might need a little bit of elastic to be able to tighten your girths. So there's always pros and cons with the use of elastic. Elastic both sides is far better than having it one side, and elastic that's fairly thick and fairly stable in its structure is another way. But again, it's about finding the best thing for your horse, your rider, and your saddle combination. So that's where your saddle fitter will help to advise you, and you can discuss through the pros and cons in your individual animal.
Thank you, Helen. Sarah would like to know, how many times a year do you suggest to see a horse and rider?
Oh gosh, this again is very dependent. In a perfect world, I would normally suggest a leisure rider, someone who's perhaps hacking out and doing a little bit of low-level competition. We see you twice a year, but again, keeping very much an open dialogue between us. Competition riders a little bit more often. Some studs and larger competition yards, we do actually go in every 6 weeks, particularly with the young horses that are changing at this time. It's much better to keep on top of it and make minor adjustments than having to suddenly go in and make a big adjustment. Horses that are perhaps traveling abroad, we'd always suggest seeing them a couple of weeks before they go, so that the saddle is balanced at that point, and the rider and the horse is then accustomed to that balance when they go. Some horses, when they travel internationally, can lose weight, so again we need to have a plan in action, what's going to happen then. It's really about, again, having your open dialogue with your saddle fitter, being able to ring up, have a chat, and making sure that you have a holistic approach to this. There's no real hard and fast rule, but it's better to be have more appointments than less. You can always cancel them and everything's fine, but you might find it difficult to get an appointment quickly unless you have one in place. So it's really keeping that dialogue open. Thank you, Lucy.
Thank you, Helen.
Lucy, thank you so much. Now, ladies and gentlemen, that is the end of this question and answer session, but I would like to thank you all very much indeed for listening to us. And there are one or two words which I'd like to add. We on the panel really feel that cooperation and communication between paraprofessionals in the production of the young horse is of most importance and has a high influence on the welfare, the performance and the longevity of our horses. We're all in a difficult position at the moment. I have to say, and I'm proud to tell you, that the 4 panellists have all undertaken this completely free of charge, given up their own time, and we've spent a great deal of time producing this. So we're delighted so many people have taken part, and I would now like to publicly thank you all. Thank you. The sponsors have been excellent, and the sponsors have covered the cost of producing this. Now we need to consider taking this forward. We need to consider closer collaboration, communication and cooperation between everyone that works to produce the foal to, let's say, 5 to 7 year old. It's to everybody's interest. I'd like to take this forward. I had in mind having a 2-day seminar, perhaps next February, but I think that's going to be highly unlikely. There are many of us who would not wish to meet in a large group until we have a vaccine for COVID-19. Therefore, I would like to ask for your help, please. I would propose that we consider another webinar, but this time a whole day webinar rather than just a couple of hours, with other invited speakers over a broader spectrum. Again, because so many of us will have difficulties for a year or 2 to come, I would like it to be free. So I would invite you, please, could you email me at jane@nixonequinevetconsultancy.com with your ideas with regard to persons who might participate on the panel, ideas about topics, and anybody who would be keen to sponsor this. I really do hope that we can take this forward, and I look very much forward to your comments. So thank you all very much indeed. Goodbye and keep safe.